Welcome to Digital Health Talks. Each week, we meet with the healthcare leaders making an immeasurable difference in equity, access, and quality. Hear about what tech is worth investing in and what isn't as we focus on the innovations that deliver. Join Megan Antonelli, Janae Sharp, and Shahid Shah for a weekly no BS deep dive on what's really making an impact in healthcare.
Welcome to Health Impact Digital Health Talks, the podcast where we explore the cutting edge of healthcare, innovation, and technology. I'm your host, Megan Antonelli, and today we're thrilled to have with us Scott Arnold, the Executive Vice President and Chief Digital and Innovation Officer at Florida Health Science Center, which includes Tampa General Hospital. Scott is a true pioneer in healthcare technology, overseeing a diverse portfolio that includes IT, cybersecurity, analytics, clinical engineering, and even a venture fund. Under his leadership, Tampa General Hospital has earned multiple prestigious awards and recognitions in health information technology. Well, Scott, welcome to Health Impact Digital Health Talks. I'm so excited to have you here. I have followed your career for many years, but we have yet to meet in person. So I'm so glad we're able to do this today. Thanks for being here.
It's exciting. I appreciate that. I've been looking forward to this for a long time. So great to be here, Megan.
Yeah, it's good to finally connect, and as I said, you've been with Tampa General for a while. Tell us a little bit about, just kind of where you've seen things change and what your experience has been.
Sure.
A lot of work on sort of modernization of the organization. And I'd love to hear your story about that.
Yeah, fantastic. Well, I have been with Tampa General for going on 14 years. And I talked to somebody a little bit earlier in the day, and they had pointed out the number of years and the fact that typically a CIO or digital leader is got the lifespan of a dragonfly. So now it's really got me overthinking. But I have had the pleasure of working and perhaps even surviving for four different CEOs, and the CEO for our health system now. I've gotten along with all of them great. The one we have now is a lot of fun for me. We're a lot alike, and we see the world very similarly, which really helps. Kind of helps with the just kind of getting things done and how we organize our team. But over those years, we've organized the technology division a little bit differently along the way, kind of just based on whatever is happening and current at that time and whatever's relevant. So 14 years ago, there was a big focus on, laying down the electronic health record platform, and really that was a focus. And then, over the years, we've evolved to other things, to growth and expansion, and now the team and I are really focused on really the digital experience through multiple lenses, but the two that we're really focused on, that we're looking at, kind of even reorganizing our team around, are really the team member digital experience. So what does that feel like, taking the logon experience, the choppiness that may exist because, as well, traditional technology divisions are put together. They're typically put together with applications and infrastructure, and nobody really has looked horizontally on the experience for the team member, from onboarding all the way through, how the day goes. And it could be the portal or shift bid technology, even the bedside tech or mobile apps. Just that experience, we kind of think of it a lot like an airline. If we really focus on our team members first, they'll take care of the patients, and those types of things take care of themselves. And the patients, really clearly, the other piece of this is the digital experience for our patients, and that's that's another way that we're kind of reorganizing our team is are putting people together that are really focused and really driving the patient digital experience, because it's more than just a patient portal or my chart. It's how they're interacting with our health system, from the outpatient setting, from urgent care, from emergency room, to primary care and other venues. And we want the we want that experience to have some as much friction removed as possible, and and how how it interacts with our experience center as well. I mean, it's a big job to put those things
Yeah.
together and then just look at things differently, across that horizontal. So those are really kind of some of the two big areas that we want to cluster and kind of organizationally design around. But other things that have emerged that I'm thinking about are even video technology. And well, I mean, everybody's got an AV guy or a person, but now, when you think about virtual nursing, fixed assets in patient rooms for hospitals, or even computer vision inside of operating theaters, and how that will be used, it's kind of created a whole new you know space that we really need to have thought leadership around and strategy around. So that's our particular area. And then also, what's interesting is robotics, and not necessarily like the Da Vinci robot type of thing, but I'm talking about the robots that do tasks around a hospital, as an example. So picking up trash, delivery of linen, we're finding that we need to, kind of organize for that skill set, because some of the things that we're doing with our venture team, our innovation team, kind of the team that's looking at emerging technologies, there's not always a clean drop off, for where does that belong, in the traditional IT format. And we're usually making it up as we go, but we have that. The
Yeah.
last thing I think I'd tell you is I feel I think super blessed to be able to have the technology vision, or really the vision of technology and the division itself, wrapped with traditional IT, with cyber, with analytics, with our venture and emerging tech team, and biomed, and probably a few others that I'm not even thinking of right now. And as I talk to my colleagues, there's no right way to do it. And I'm certainly not, we're not running a monarchy here, but it sure does run a lot easier when you have, all of those people together, working together, and not against each other.
Right.
So that's
Well, that
that's
is
kind
a
of what's
lot.
going on
That
here.
is a lot of hats to have worn for the last 14 years, right? And certainly changing them while the car is moving as well. So it's but I mean, I think that's amazing. And I think as you started with the sort of that shift, right? That to the digital experience for both your patients
Mhm.
and your team members, and the clinical teams. And certainly that's not where we started, right? I mean, when we were looking
Mhm.
at implementing electronic health records, and they were mostly billing systems, that UX was unfortunately not
Yep.
not for top of mind, right? But now it is, and I think it does mean there's some reverse work that has to get done to build better systems around it. But it sounds like, from where you sit, that you have that view of ultimately the, multiple the players, and where they come together. So that's amazing. You
Yeah.
mentioned the venture side of
Mhm.
things, and the venture fund that you guys have. Tell us a little bit more about that, and what you guys are looking at.
Yeah, I mean, we have a great team put together for venture, and as health system venture teams go, or not necessarily teams, but the size of fund, I'd put ours really kind of on the smaller emerging side, although I feel like our team is is the type of team you'd find at really any fund. It's a fantastic team that's put together that just does this day in and day out. But our venture fund itself has started with about $15.5 million in it, and the idea was really kind of put our money where our mouth was, because innovation is part of our shared purpose and or mission, if you will, and vision. And the way that we were accomplishing that in the past was, we were really gambling with technology money on some things that, the money that we were using was to run our operations. So if it didn't work out, then I'd be scratching my head wondering how I'm going to cover. So we put a separate team together, with money that's specifically for doing new and innovative types of things, and primarily it's around technology, but it's not always technology. And and it's worked out quite well, and we've really focused in two spaces. Primarily direct investing into companies that are either startups or emerging, or kind of in on that pathway of Series A, B, or C, in terms of their growth. But we're not doing it just for the sport of it. It's a direct alignment with one of our strategic imperatives, right? So if it's helping us solve a problem, or if it's a direct line to one of the strategies that we have for the health system, then we definitely take a hard look at something like that we're both using, but also taking a hard look at investing in it as well, and being a partner that way. So we have, I'd say, just probably more than 10 portfolio companies that we've invested in the short time we've had it up and running. And I think we look forward to kind of making our $15.5 million fund even larger. The other piece that we do is really kind of fund investments. So not necessarily direct to companies, but other professionally managed funds that focus on supporting health tech startups, and having access to that portfolio of companies. So again, the benefit for us is trying new things or having exposure to new things early that will you know support lowering the cost of healthcare or giving us a competitive edge. So
Yeah.
it's been a lot of fun.
Yeah, it is. I mean, and it's great to be able to wear both hats, right? So it sounds like you both sit in that innovation space where you get to, look at
Mhm.
what's coming and what's new, but also work a lot on, the
Yeah,
stuff that keeps the lights on, right? And the
that's
kind of
right.
stuff that
That's right.
keeps things moving. So it's
Yeah.
nice to be able to wear those hats, but also, I mean, and I think like from my perspective, certainly when I started doing events in healthcare technology and bringing people together around these discussions, I wanted it to be much more about the technology touching the patients, right?
Yeah.
It's like, oh,
Yeah.
it's all about the patients, but the reality is that so much of it is, you know, not, I mean, just it's
Yeah.
the stuff that keeps the organization running. And, not all of it is specific to healthcare, but it all is wrapped in a healthcare package, which, means that it touches many patients and providers and has to serve them. But the innovation space is super exciting.
Yeah.
Are there any particular portfolio companies that you're super excited about?
Yeah, there are quite a few. Somebody's going to be upset if I don't mention them, but we're working on one now. Like we're kind of like we're the hair club for men. We're not only a client, but we're an owner,
Uh-huh.
or an investor. And there's one right now that we're implementing a specific technology that will support access and just kind of modernizing our digital front door a bit. And it's a company called DexCare. I'm very, very excited about that.
Right.
So that's a good one. And there's, a handful of others, but I will say, I think I can't undervalue the, the opportunity that I have to, to have that, venture, group part of our technology division, because as I talk to some of my colleagues around the country, and again, there's no one, perfect or best way to do this, but there could be a lot of friction between, an innovation group that is kind of stood up and, over here, and then you have your traditional, technology group or IT group that's over here. And guess what? They're innovators too. They just don't like to be a utility and keep the lights on. You want to get the best out of people and inspire them, and they're inspired to try new things. So, having those two groups together, working together instead of working, seeing each other as a threat,
Hmm.
um, that's really worked out for us. And, again, that it's not perfect, and we're kind of working through some things, but I think we're moving a lot faster
Yeah.
because, we've put those things together. And I,
What's interesting, because it kind of
yeah,
that goes again, I mean, going way back, right? Because Clayton Christensen, where you had to, disruptive innovation, and it had to be kind of,
yeah,
that was
yeah, Britt,
the
yeah,
original strategy, was to pull it out, right? To keep it
yeah,
separate. But
yeah, yeah,
it does seem to me that we are, I mean, just across many health organizations, pulling it back in, and I guess to some degree, even technology itself, right? When we started this, technology had its place, and now it's everywhere, right? So
yes,
to not,
omnipresent. Yeah,
right, it's omnipresent. It's part of every part of the organization, and every function and every department has a technology component. And then you layer on top of that the need to innovate at every level, whether it's at the janitorial level, at the facilities level, and
sure.
and
Yeah,
at the robotics doing surgery level. So
right.
there's multiple, it's a large spectrum. So that's amazing, and certainly, what keeps your job interesting and hard, no doubt.
Yeah, it does. And I think a lot of it has to do with, and again, I said there's not a right, I don't know that there's a right way to do it. There are, I think some health systems that are, actually very, very successful having those two things in different places. I just happen to see that there tends to be a little bit of friction there. You have a group of people that may feel disenfranchised on the other side of this, and they're innovators too. And you just, again, you want to get the best out of people, and then the leaders on the top of this, has a lot to do with, the personalities of those people and how you can get everybody working together. That makes a difference too. So
Mhm.
all kinds of ways to do it. I feel like it works really well for us by having those things together. And I think if you were to ask the leaders of, kind of both of those functions here, that they would tell you the same thing.
Yeah, well, that's great. Well, in addition to innovation and the venture
Mm.
fund, you also wear a hat that maybe some folks have said, I don't want this to be part of my job. It's too hard and too scary. So, but also has been quite the discussion, and it's like a day doesn't go by without a discussion of some of the cyber attacks and threats within the organizations, across healthcare. And I know, you guys have handled that, well.
Yeah.
Tell me a little bit about that part of the job and what that's looking like these days.
Yeah, you're absolutely right. It's the worst part of our job. It's generally the phone call that I get on the weekends, at night, on vacation, like, hey, something's happening here. I feel, again, very fortunate. We've got a super strong, cybersecurity team that, um, does everything they can to keep our patients and team members and partners safe. But look, I'm in that, a growing percentage of, leaders and health systems that have been through, an unfortunate event like this time last year. was a bad day for us. Actually, it was a bad few weeks, and I would describe to you that it is the thing that kind of sucks the life out of the job, is that we have to spend so many calories on what bad people are doing, and the onslaught to healthcare has just been non-stop. In fact, the attack that hit one of our, a really good health system in the Midwest, or frankly all over Ascension, that same group, before that hit, tried to hit us 900 times two weeks prior to that, 900 attempts. And I'm sure any of the other leaders that either are a part of this or listen to it, they would tell you, have similar stories. Um, I think that it's terrible. I've never actually been through an encryption event, but certainly a ransomware. We had multiple encryption attempts, and we managed to keep those off the top of us. That is a worse nightmare. And I've just been,
So
watching.
for folks who might
Yeah,
not know the difference, including me,
sure.
tell
Okay.
me the difference.
So, the ransomware event and encryption, you hear those kind of things together, but what the bad guys typically try to do is, is uh, basically gain access to your systems and lock them down so you can't get back into them, you can't use them, and while they're at it, they're stealing data, so they're holding it ransom. In our case, the bad actor came in through one of our partners, was compromised and came in through the side door, and frankly, got a foothold and tried to drop, those encryption packages, tried to lock down some of our systems so that we couldn't get to them. And it was an epic battle for about 2 weeks, just kind of fighting that off and chasing this little ghost around the interior of our systems. And but what they did finally do was they were able to get a foothold and steal data, right? And then hold the data for ransom. um so we still have the data, but basically the threat is when you get the phone call from um, the kind of the ransomer, if you will, or the email. And we got both. The CEO and I both got phone calls and emails to solicit a ransom. They typically set their ransom at 1.5% of revenue, which is a very big number. It's a business for people that do this for a living. These financial crimes, they run it like a business, and they look at your revenue, what you can afford to pay, and then they suggest, if you don't pay us this amount, then well, we're going to release this data onto the dark web, and your patient's data or your team members' data will be all over the dark web for all to see. So that's what a ransomware event feels like. And then shortly after that, when you've kind of gone through and done containment ejection of the bad, of the bad guy, and you got your environment kind of back to a healthy state, then I call it the secondary extortion. The class action lawsuits start to ensue. Some of them are frivolous, some of them may be legitimate, but most are not, in my view. And that can be a very big number of lawsuits. And then you're tied up, a person like me is tied up 30% of my time with lawyers for the next year or 2 years. And that does suck the life out of you.
Right. Well, thank goodness the innovation part is still part of the job
Yeah,
then.
yeah, that's the fun. Yeah, that's the fun stuff.
That's,
Yeah,
I mean, thank you so much for sharing that. I know sometimes, those are the dark days, right? And
yeah,
it is hard, and and it's such a, uh, tough thing that healthcare systems continue to be the target of this, consistently. What in terms of what you've done, I mean, over the years to kind of minimize the risk in terms of educating your staff or even just sort of, battening down the hatches, what can you share with our audience around that?
Yeah, I mean, I think our strategies probably aren't terribly different than anyone else's. We do, a lot of friendly phishing with our team members. So we send them emails that kind of look like phishing attempts and do some training on the spot, if they click on the wrong thing, and then it's a teachable moment at that point. I will tell you, our team members are just getting better and better and better at recognizing things and deleting or reporting them. And frankly, it doesn't matter how much you've invested in technology to capture that and filter it out before it even gets to your team members. There's stuff that still makes it through, and you still have to deal with that. I think we've done a lot to fortify and frankly reassess and assess our partners that are absolutely critical for us to do business. But the way that we evaluate partnerships and their cyber hygiene is and not just once but continuously is really important. So I think that's a big, that was a change for us.
Yeah. A
It should
lot
have
of
been something
what
we did a
we've
long
talked
way.
about, oh, sorry, what we've talked about a little bit, and it goes back to what you said about around digital experience, right? I mean, the experience of both your team members
Yeah.
and then that battening down the hatches. So it's this balance between
Yes, it is.
making the systems accessible to the people who really need to use them and not
Yeah.
accessible. Are there, lessons from there that you've learned
Yeah.
that you've managed?
Yes. In fact, you can swing the pendulum way too far on battening down the hatches. And in fact, there's a point where it's not understandable anymore by the team. I think for the most part, team members, physicians, they kind of understand that multi-factor authentication, things like when you get into your bank or other apps that you use daily now that are less benign than a bank, that you're usually like they're making sure that it's you, and that's a multi-factor authentication. And that's becoming a little more like accepted. But I think if you don't tune that right inside of a health system, and you're asking, a provider or nurse or environmental services per you name it, billing clerk, IT person to, put their login credentials in, 1,000 times a day, that's probably taking it a little too far. So I think what we've learned is there's a little bit of tuning, and you're absolutely right, Megan. There's a balance between convenience and security, and striking that balance is a special art we're still trying to figure out as well.
Right. And along that, I mean, that you sort of makes me think about a lot of the other stuff that we've talked about, which is innovation and, the sort of burgeoning discussions of around AI, which may not be new or even that different from what we've been doing, but now there are some additional things. And when I think about security and like the added risk of kind of technology and to some degree, we're realizing this promise that we've talked about, interoperability, connectedness, but it makes us more at risk. And then when you add that layer of here, we're going to have artificial intelligence, which everyone sees as super scary, but also the promise and the potential is huge, and also not that different from what we've been doing, and
Yeah.
healthcare's been doing a lot, but are there new risks, new threats, and what are you thinking around governance and AI and how that's impacting, sort of your look to the future?
Yeah. Well, I feel a lot like you do. I'm very optimistic and bullish on AI. I think that generative AI specifically has brought this unbound, irrational exuberance around all of AI. And so we've ridden that, up the top of the curve, and it's probably coming down a little bit. People are settling out on, okay. But it's very like I think we're now kind of unlocking some new things that have been conceptual, and we were, as a health system, we were pretty quick to determine, hey, you know what? We need to put some governance around this. And honestly, Megan, I'm like the anti-committee guy. I don't like committees. I'd rather like proceed until apprehended, which is not always the right way either. But there's the right amount of governance to put in, and certainly with AI, and even how the regulatory agencies are like, wait a minute, what's happening here? And you had that directive from the White House, and some guidance from Health and Human Services, and all kinds of things in the healthcare space, the FDA. We were pretty careful to put a governance group together that would evaluate, you know, any of the assets that we have coming in that contain AI. And we put a group, a small smart team together that includes um, technology and physician leaders and administrators, legal, compliance, ethics, because there's biomedical ethics involved,
Mhm.
research, cyber, and audit. All of the actors that you think might have an opinion, and guidance around this. And it's actually working quite well. So before anything with AI that we know about, because lots of things are being built with AI inside of it now, we we put it through a pretty speedy on-ramp process to get into our health system. And as it's coming on, we're also taking inventory of that asset. So we know what is roaming around in our environment that has artificial intelligence attached to it. Until we become smarter about it, we really at least need to have an inventory of those things, and then understand what it does and how it's learning, and can it be a threat to us? Can it hurt patients? So we have, I think, the right people evaluating those things, and it's a pretty speedy process, because again, I'm not a big one on getting things stuck in committees. Again, I rather move a little quicker, but you do sometimes have to slow down and make sure
Right.
we don't make any big mistakes.
Well, as you said, it's all about balance, right? And it's about
Yeah,
that, balancing the risk with the innovation and that ability to kind of move forward. But having worn as many hats as you have for so many years, obviously, you can take the learnings from the past to apply it to this new and exciting technology. So that's great. In our last few minutes, I can't, it's you've shared a lot about kind of the landscape and where you've sort of had such great experiences and what you guys are doing, but share with us a little bit. I mean, I can't think of anybody to give sort of that leadership advice to some of our up and coming leaders, and even those who are maybe sitting there with the same role, wondering how they're going to get through another day.
yeah, yeah.
How have you kept this, kept such a balanced perspective on all of this?
Yeah. Well, there are some days I'm very confused, but because it's a big surface. It really is a big surface to cover, and I think for anybody at the actually in any part of a technology division, it's nearly impossible to be an expert in everything. You just can't expect that from anybody or yourself. So I think surrounding yourself with the right people that are super sharp, and complement each other well and get along together well as a really strong functioning team. I feel, like I've been blessed to have that here in our community at Tampa General, with leaders around me that have been with me almost the entire time I've been here for 14 years. So um, I think it's important to, again, surround yourself with the right people. They do the same thing. And then, of course, we have a strong team from that. I think the other piece of that is having a really strong handle on the strategy of your health system, because most of what you're going to do needs to align directly to that strategy. So there's turning the crank and keeping the lights on every day, but just modernizing and keeping up, and just getting the best out of your team with great leaders that do the same. That's really important. Being self-aware, emotional intelligence is right up there for me, and it just kind of having empathy and understanding, especially around new things, listening to team members, because introducing innovation and change, like, humans don't really love change generally. So just listening and having that empathy, and then just influence and change management. It's a
Yeah.
lot of things bundled together, but I think
That's the job.
that is the job. That's the job. Always moving and always being curious.
Yeah. Yeah, well, that's great. I'm so excited that we've had, been able to have this conversation as I
Yeah.
have watched you navigate all of that so well over the last 14 years or so. So it's an amazing thing, and I'm excited to see what you'll continue to do at the organization. So
Yeah. Thanks so much. This has been a lot of fun for me. I appreciate it, Megan.
yeah, thanks, Scott. Thanks for being here. Thanks for listening. That is the show for today. Megan Antonelli with Health Impact.
Thank you for joining us for this week's Health Impacts Digital Health Talk. Don't miss another podcast. Subscribe at digitalhealthtalks.com. And to join us at our next face-to-face event, visit healthimpactlive.com.